Okay, all good? I'll take that as a yes. Thank you for coming along this morning. I can advise that currently there are some 22 active cases of coronavirus in Victoria. I'm pleased to advise that there have been no new cases notified overnight, and that, of course, therefore includes no locally acquired cases and no new cases in hotel quarantine. Testing, of course, remains the most important tool for us to respond to and get on top of any potential community transmission. And that's why I was pleased to see the figures for yesterday with some 23,227 tests, which is a very reassuring figure. That's a huge effort by Victorians, particularly in those areas that we've asked Victorians to come forward and get tested, to keep themselves safe, to keep their families safe, and to do their piece for keeping all Victorians safe. There's been a massive public health effort supported so strongly by the Victorian community over the last few days to make sure that we stay safe and at the same time stay open. And the public health team, the test, trace and isolate procedures that we now have in place, the combination of data, people and cooperation has been outstanding. I want to thank everyone who has been involved in those public health actions, because so far, we still have some way to go, that has been a really important contribution to get us to where we are. I can update Victorians that the positive case of the gentleman from Noble Park continues to be managed as a result of all of that data and testing in an increasingly positive way, but we have a way to go. I can update everyone that 100% of the gentleman's primary social and close contacts, that is his household members, those people he met with over the period of which he was infectious, 100% of those tests have now come back and they are all negative. In regards to the 767 workplace close contacts identified, all of those have now been contacted, and the testing and the isolating arrangements are very well progressed, together with the 362 close contacts which have come forward as a result of the 14 exposure sites that we've identified. People have come forward to be tested and isolated as a result of those. Those tests, a lot of them are still in the system, but I can update people that of these 1,129 other primary close contacts, 60% of the tests have now come back, and reassuringly those have all tested positive. And I want to thank all of those people for coming forward, getting tested and isolating and doing the right thing. This is encouraging, but we do know that there will be more results needed over the next few days. The next 48 hours will be critical in making sure that we're in a position to get on top of this. Anyone who has been at those exposure sites, anyone in and around those suburbs, indeed any Victorian anywhere who has even the slightest symptoms should come forward to the testing sites and get tested and isolate until you get those results. If you have been at those exposure sites, let us know, because we will work through the issues of how you need to be supported in being tested and isolating for the period ahead. I can also advise that as a result of that, the 562 secondary close contacts, if you like, that outer ring from the primary close contacts, they continue to isolate and they continue to be tested, and they are required to isolate until their link, the primary close contact, returns a negative result. Some of those results are obviously the 60% that I referred to earlier is already seeing some of those people being able to be released. I want to thank all Victorians for their outstanding efforts. I want to reinforce the message that this is not over, that this wildly infectious, particularly now we know it is this mutant UK strain, continues to be highly infectious and a real risk to all Victorians. It's up to all of us to stick together, to follow the science, to follow the public health advice and do the right thing to keep yourself safe, your family safe, and all Victorians safe, and therefore keep us both safe and open. I might ask the Chief Health Officer to add to my comments, and then Minister Neville will report on a whole range of changes that are being made to quarantining arrangements, and then of course we're happy to take your questions. Thank you.
Thanks, Minister, and good morning. Yeah, good? Excellent. Thank you. A 0 day is a great day any day, but in particular with this strain first identified in the UK, having no positive results out of those exposure sites and numerous primary close contacts is very encouraging. But as I said yesterday, it is early days. Some of these exposures occurred right at the end of January and in the first few days of February, Feb 1, 2, 3. So it's only been a few days really since some of those exposures have occurred. So we do need to see that full 14 days of the incubation period play out before we can be absolutely happy that we're in safe territory. As the Minister said, anyone developing symptoms really over that period of time, anywhere in Victoria, but particularly in those suburbs where the exposure sites have been identified, must come forward. I've reminded people on many occasions about the symptoms, but it could be as simple as a runny nose, a sore throat, a headache, fever, a dry cough. Any symptoms that are compatible with COVID-19, please come forward, get tested, and you've got a 96 to 100% chance of getting that result within 24 hours, so you can get that reassurance and get back to normal daily living. So a 0 day, absolutely encouraging, but lots of close contacts, lots of exposure sites, and we really need to see that 14-day period play out before we can be much more reassured about no further cases occurring. I know people have questioned the fact that the case in Brisbane, the case in Perth and the case in Melbourne have all led to no further cases. It is a more infectious virus though. N equals 3 is a small number. There is a bit of luck, a bit of randomness involved in the fact that no cases have been identified. I'm also encouraged by the fact that the exposure sites for this particular case are the very sites where we're asking people to wear masks indoors. The Kmarts, the Coles, the Bunnings, that's really important, and that might have played a role in the fact that there are no positive cases. So we do need to keep those measures in place because they are important protective measures. I'll throw to Minister Neville just to update on quarantine issues.
Good morning.
Certainly for the Park Royal transmission, it does look like it's a case of doors being open at the same time. So that's being addressed now. That's an issue that was present for food deliveries, but it was also an issue for when individuals get tested on their routine testing times. I think that's the primary mechanism for the Park Royal. With respect to the Hyatt, I'm not sure we'll find out exactly what happened in that regard. Again, issues that have been identified in Queensland might be at play here. We just need to look at each and every potential transmission pathway and deal with it. Critical incidents can inform that, but sometimes even when you don't know, you just need to look at the systems issues across the board, apply them for each and every person who's in quarantine, and try and tighten it, across each and every quarantine setting.
Does it surprise you that those two groups of families, that family and that other woman, were able to be infected by just having their doors open at the same time, yet this worker has walked around, been to lots of different exposure sites, visiting Kmarts, visiting supermarkets, with a very high viral load, as you described the other, and no one else has been infected thus far?
We do know that there are some critical things that sometimes happen with an individual, that there's an extremely high infectivity for a particular individual. For the Park Royal, there was an entire family who were infected. They were in their room, all shedding virus, which would have contributed to a very high kind of viral fog, if you like, that would have been a particular risk. For this individual who was going out and about, obviously when you're outdoors, the risk is much less. And when he was going indoors, all of those settings that we recommend everyone to wear a mask, that clearly mitigates the risk, and I'm sure that played a role in his case. Yes, he had test results that indicated that he should have been quite infectious. We're yet to see whether some of his very close family and social contacts have turned up positive. They're negative thus far, but they do need to see out that entire 14-day quarantine period, and they may turn up positive. I hope not, but we shouldn't hang everything on that early test result. Yeah, they'll routinely test at the end of that quarantine period again to ensure that they've got a negative before they're released from quarantine. So the hotel quarantine workers, or the Hyatt workers, need to do a full 14-day quarantine period, but their close contacts, the secondary close contacts, are also in quarantine until the primary close contacts return a negative. For those who've gone to exposure sites, they need to do a 14-day quarantine period, but there aren't secondary close contacts for those individuals. They are a lower risk group. So it's all of those. So where QR codes have captured people, we can go out to those individuals and make sure that we're contacting all of them. Anyone who comes forward from a site that maybe doesn't have a QR code, we go through an interview process with them and identify where they've been. So it's all of those. We're obviously encouraging people to check for any updates on the exposure sites that are published on the DH website now. And anyone who comes forward, we're taking them through that process of testing. Look, there might be some people who haven't come forward, who haven't reviewed that exposure site. So again, for people especially in the southeast of Melbourne, we're saying go to the Department of Health website, have a look at those exposure sites, the specific times that are very tight, and see if you're potentially a close contact.
At this stage, is the only person in hotel quarantine the worker himself? No one else has been in hotel quarantine?
As far as I know, he's gone to the Medi Hotel. Everyone else is isolating at home.
And how are you policing that? It's a lot of people now that are having to stay.
Yeah, so they're all checked in by the team. There are text messages, there are phone calls made, but we're hoping that people are doing the right thing in between time, obviously. Oh, so that was a change to directions that was made on the Wednesday, really out of this case, and it was for masks to be mandatory indoors in any setting. So that applies to the stadia at the Australian Open when the roof's closed. It's like any other indoor setting, but that change was made on Wednesday. Clearly, the settings were different prior to that, and it wouldn't have applied. But now that's an across-the-board change for indoor settings. That's right.
The extra 8,000 tests that came through yesterday,
Yes.
the Premier announced, are they reflected in today's numbers?
Yes, they are.
Okay, so it's correct to say that yesterday, 14,500 taters, so I believe it's 22,500.
So we work on a midnight to midnight system of reporting. So there will be a large number of tests from yesterday that would have made the cut-off from midnight, and there will be even more in the early hours of the morning as our pathology and public health team work around the clock as part of the hundreds, if not thousands of people working so hard to keep Victorians safe. So my message on testing is, as the Chief Health Officer has said, if you are in those southeastern suburbs or anywhere in the state of Victoria, get yourself tested if you have even the slightest of symptoms. If you have been at the specific 14 sites, particularly at the times that the gentleman from Noble Park was very precise in his record movements, you definitely need to get tested. And I want to thank the just double check my figures. I want to thank the 362 people who have come forward from those exposure sites at those specific times to get tested and isolate. You are doing an enormous contribution to keeping all Victorians safe, and we would expect, as the QR code systems and our public health team work through the material provided by those sites, we would expect that number to go up. So I'd take this opportunity to reinforce the message: please, the slightest of symptoms, come forward and get tested. If you've been in those exposure sites, please come forward, let us know, get tested and isolate.
In terms of, because so many COVID quarantine workers now out of action because of their contacts, and also that there are also rooms that are taken out of circulation for this program, what impacts are having on the program and limitations?
Look, the program is fine at the moment. So we had, as you imagine, some excess staff because of we had all these staff trained for the tennis, and this only affects the Grand Hyatt. So we've been able to utilise those staff who were due to stand up the View Hotel to go in, because we're just using staff from one hotel. You don't want to cross over. So at the moment we're confident. People are isolating 14 days from last exposure, so some of those start to come off this week as well. At this stage, we're on track to stand up from extra on the 15th of February, but if there's anything in the ventilation issue or anything to do with the staff because of numbers, then obviously we'll review it. Our system is about safety first, and if there are any challenges about that, we'll review that date, but at this stage we're on track to stand up on the 15th of February. Yeah, so look, it will vary a bit. So, for example, this is anywhere that's, so it's where you've got large families. Large families will be kept separate, particularly at end of corridors, so no one across the room. If there's doors really close together, so we've gone through again and looked at each of the configurations of each floor, so it will vary depending on the floor and the configuration of the hotels. So I think, does Brett, do you know, I think it was 15, wasn't it? 15 CFA. So far they're all negative. There was no FRV primary contact. It was a secondary contact, and they're clear as well. It was CFA volunteers that were the 15 of them, and they will need to isolate for 14 days. And they, as I understand, there's no impact on service delivery in those communities from the CFA.
Well, good.